A stroke rarely knocks someone down without warning. Most of the time, the body already sent a quiet signal minutes, hours, or days before. The problem is that these early signals are so subtle, so easy to explain away, that most people simply talk themselves out of taking them seriously. Today we are covering 5 subtle stroke warning signs that people often ignore, brush off, or blame on something completely unrelated. For each sign, you will learn what people usually mistake it for, what it might actually mean, and what action actually matters if it happens. This is general health education, not a diagnosis, and if anything here feels personal, please talk to a real doctor about your specific situation. None of these 5 signs are rare medical mysteries. Every one of them has a completely ordinary, harmless explanation most of the time, which is exactly why they get ignored so often. The goal today is not to make you afraid of every headache or dizzy spell. It is to help you recognize the specific pattern that separates a harmless moment from a genuine emergency. Knowing these patterns does not mean living in constant fear of your own body. It simply means reacting quickly on the rare occasion that quick action truly matters. Most strokes happen when blood flow to part of the brain gets blocked, cutting off oxygen to brain cells that need it constantly to survive. Some strokes happen differently, when a blood vessel actually bursts and bleeds inside or around the brain instead of simply being blocked. There is also something called a transient ischemic attack, often nicknamed a mini-stroke, where symptoms appear briefly and then seem to fully disappear. Even when those symptoms disappear completely, doctors still treat this as a serious emergency warning, never as something safe to simply shrug off. Major clinical guidance often cites that roughly 1 in 3 people who experience a mini-stroke eventually go on to have a full stroke later. That risk can appear again relatively soon afterward, which is exactly why a disappearing symptom should never be treated as a disappearing problem. Think of a mini-stroke almost like a smoke alarm going off briefly and then falling silent. The smoke may have cleared, but that does not mean there was never a real fire risk in the first place. The first subtle sign to know is sudden weakness or numbness on just one side of the body, even if it fades quickly. People often mistake this for sleeping in a strange position overnight, a pinched nerve, general tiredness, or simply poor circulation in that limb. Here is what it may actually mean. The brain controls the opposite side of the body, so a blood flow problem on one side can show up physically on the other. That is why this weakness so often shows up as one arm feeling oddly heavy, one leg feeling wrong, or one side of the face feeling different than the other. If the weakness is mild, or only lasts a few minutes, people frequently rationalize it away instead of recognizing the important one-sided pattern hiding inside it. The safest response here is simple: if it is sudden, and especially if it is one-sided, do not wait around to see if it happens again. Seek urgent medical evaluation immediately, even if the weakness already seems to be improving or has fully gone away by the time you notice it. This sign is worth taking seriously precisely because the brain's wiring crosses sides, which means a subtle, easy-to-miss clue on one side of the body can point to a real problem happening deep inside the brain itself. The second subtle sign is brief trouble speaking, sudden slurred words, or momentarily being unable to find the right word mid-sentence. People commonly mistake this for stress, tiredness, distraction, low blood sugar, or simply saying, "My brain just froze for a second," and moving on. What this may actually mean is a temporary interruption in blood flow to the brain regions responsible for producing or understanding language. This disturbance can be subtle. Someone may know exactly what they want to say, yet suddenly sound wrong, mix words, or briefly struggle to understand simple sentences. Stroke does not always look dramatic on the outside. Sometimes it is simply a person sounding slightly off, or unable to repeat an ordinary sentence correctly. Sudden language change like this is considered a classic red flag, so note the exact time it happened and seek emergency help right away. This particular sign gets missed constantly in daily life because slurred or jumbled speech is so easily blamed on being tired, distracted, or simply mumbling through a busy day. The third subtle sign is a sudden vision change affecting one eye or both eyes, even if it seems to resolve on its own. People often mistake this for eye strain, a migraine aura, a smudge on their glasses, general tiredness, or simply standing up too quickly. This may actually mean reduced blood flow to the visual pathways in the brain, and sometimes to the eye itself, depending on exactly where the problem occurs. It can show up as dim vision, partial blindness in part of the visual field, sudden double vision, or a strange curtain-like loss of sight. People often fail to connect vision problems to stroke at all, because they expect something more dramatic, like sudden collapse or obvious face drooping. If the vision problem is painless, brief, and seemingly minor, people frequently delay seeking help, which is exactly the mistake this video wants to prevent. The brain plays a huge role in vision itself, so a stroke can genuinely show up first as an eye symptom, even when the eye is perfectly healthy. Sudden, unexplained visual loss, or double vision, deserves urgent attention immediately, not a wait-and-see approach until morning. Vision problems are especially easy to dismiss, because so many harmless daily habits, from screen time to poor sleep, already cause minor eye strain on a regular basis. The fourth subtle sign is sudden dizziness, trouble with balance, or unexpected difficulty walking normally, especially if it comes on without warning. People commonly mistake this for dehydration, an inner ear problem, overheating, ordinary vertigo, or simply standing up too fast after sitting for a while. This may actually indicate a problem affecting brain areas responsible for coordination and balance, particularly regions like the cerebellum or the brainstem. Because many harmless conditions also cause dizziness, people frequently downplay this symptom, assuming it will pass on its own without any real cause for concern. Stroke-related dizziness becomes far more concerning specifically when it is sudden, unusually severe, completely new, or paired with weakness, vision change, or speech trouble. Sometimes this shows up simply as unexpected clumsiness, veering to one side while walking, or feeling bizarrely off balance for absolutely no clear reason at all. If dizziness arrives suddenly and feels genuinely out of character, especially alongside any other sign from this list, treat the entire situation as urgent. Balance problems are particularly tricky because everyday causes like dehydration or standing up too fast genuinely do explain most dizzy spells people experience in a normal week. The fifth subtle sign is a sudden, severe headache with no clear cause, especially one that feels noticeably different from any headache experienced before. People often mistake this for a stress headache, dehydration, sinus pressure, or simply describe it as one of those headaches that will eventually pass. This symptom is especially concerning in hemorrhagic stroke, where bleeding in or around the brain can cause sudden, intense, explosive feeling pain. Not every stroke causes a headache at all, but a sudden, unusually severe, or explosive headache absolutely deserves serious and immediate attention. People with a long history of regular headaches sometimes normalize pain that is actually different in speed, intensity, or associated symptoms this specific time. The real red flag here is not simply any headache ever, it is a sudden, severe, and genuinely unusual headache pattern that feels wrong. This becomes especially urgent if the headache arrives together with nausea, confusion, sudden weakness, vision trouble, or difficulty speaking clearly at the same time. A dramatic new headache pattern like this should never be quietly self-diagnosed from the couch while simply hoping it improves with rest. Here is the single most important pattern connecting every sign on this entire list. Stroke and mini-stroke symptoms are almost always sudden in onset. A person can feel completely normal one moment, and then abruptly feel weak, confused, visually impaired, or unsteady the very next moment without warning. That suddenness itself is one of the biggest clues, far more important than the exact symptom, when deciding whether something urgent might be happening. One of the most valuable points in this entire video is that symptoms which disappear are still genuinely dangerous, not automatically safe. People often relax completely once a scary symptom fades away, assuming their body somehow fixed the problem on its own without any outside help. A temporary blockage can clear by itself, but the underlying cause behind it very often remains, quietly waiting to cause a larger problem later. This is one of the most important education points in this entire video because it directly contradicts how relief usually feels in the moment a scary symptom fades away. There is a simple framework doctors use to remember the most common emergency stroke signs, and it is worth knowing alongside today's 5 subtle signs. Balance loss, eye or vision change, face drooping, arm weakness, and speech difficulty are the core signs, with the final letter standing for time, meaning time to call emergency services. Notice how closely that framework overlaps with several signs from today's list, especially balance, eyes, weakness, and speech difficulty covered a few moments ago. This overlap is not a coincidence. Both approaches point at the exact same handful of brain functions that tend to fail first when blood flow gets disrupted. Learning this simple framework alongside today's 5 subtle signs gives you 2 overlapping ways to catch the same warning, which genuinely increases the odds of noticing something in time. Here are a few useful contrasts worth remembering. I slept on my arm weird versus sudden one-sided weakness that appears without any obvious cause. I am just exhausted versus abrupt, sudden trouble finding words or speaking clearly in the middle of an otherwise normal conversation. My eyes are strained versus sudden visual loss affecting part or all of your vision without any clear explanation behind it. I am just dizzy versus sudden coordination failure paired with any other unusual symptom appearing at the exact same time. It's just a headache versus a severe, unusual, explosive feeling headache, unlike anything experienced before in a person's normal pattern of headaches. If you notice any of these sudden changes in yourself or in someone near you, treat sudden neurological change as a genuine emergency immediately. Note the exact time the symptom started, because that timing detail matters significantly for the treatment decisions doctors will need to make quickly. Call emergency services rather than driving yourself to the hospital whenever possible, since emergency responders can begin critical evaluation and treatment during transport itself. Emergency teams can also alert the hospital in advance, meaning specialists and equipment may already be ready and waiting before the person even arrives at the door. Never wait around to see if the symptom returns, gets worse, or resolves completely, because waiting can cost precious, irreversible time during a real stroke. Even if the symptom has already disappeared by the time you notice it, still get evaluated urgently, since the underlying cause frequently remains present. If someone cannot speak clearly, cannot smile evenly on both sides, cannot lift both arms equally, or cannot see normally, that is not a moment for guessing. It is also worth remembering that stroke symptoms usually affect just one side of the body or face at a time, which is part of what makes the pattern recognizable once you know to look for it. People sometimes hesitate to call for emergency help because the symptom already feels like it is fading, worried they might be overreacting to something small. Medical professionals consistently say the opposite is true. It is far better to call and be wrong than to wait and lose critical time during an actual emergency. The scariest thing about a stroke is not always how loud or dramatic it is when it actually happens to someone. Sometimes it is simply how easy it feels to explain away in the exact moment it is happening, right in front of you. A weak arm, strange words, blurred vision, sudden dizziness, or a headache that feels wrong. People talk themselves out of urgency every single day. The safest message to remember from this entire video is simple. If the brain suddenly starts acting strange, take it seriously, and take it seriously fast. If this video helped you understand your own body a little better, there is another video on this channel covering everyday habits that quietly support long-term brain health. Watch that one next, and consider sharing today's 5 signs with someone older in your life who might genuinely need to hear them. Print these 5 signs, save this video, or simply talk about them at your next family dinner, because the person who benefits from this knowledge might not be you at all. It might be a parent, a grandparent, a neighbor, or a coworker, and a few extra minutes of awareness genuinely can change how quickly someone gets help.